Hello, I am Dr. Priyamvata, consultant neurosurgeon at Manipal Hospital, Whitefield. Today I would like to discuss on an interesting topic called trigeminal neuralgia. Trigeminal neuralgia, otherwise known as tic douloureux, is a severe lancinating, sharp current-like pain which usually occurs on one side of the face, usually involving the jaw and the lower part of the cheek. It's caused by the irritation of the trigeminal nerve, which is otherwise known as the fifth cranial nerve of the brain. We have two trigeminal nerves, one on each side, and the trigeminal nerve is responsible for providing the sensory information to the face. Things like touch, pain, which are normally felt on the face, they are carried to the brain via the trigeminal nerve. It also helps us in certain functions like chewing. Sometimes there is irritation of the trigeminal nerve, which is usually caused by the pressure on the trigeminal nerve, which occurs at the point where the nerve originates from the brainstem, which is the area called pons. Usually this compression is caused because of the pressure of a normal artery or a vein, usually by an artery called as the superior cerebellar artery. So when there is irritation of the nerve, the patient experiences severe pain, which is normally extreme, and it's a lancinating pain occurring for a few seconds. There are three branches of this nerve, namely the V1, V2 and the V3 branch. The V1 branch, it supplies the forehead and the scalp. The V2 branch, it supplies the cheek, and the V3 branch supplies the jaw. So usually the pain is perceived on the jaw and on the cheek side. Very typically, trigeminal neuralgias usually involve one side, but very rarely they can be bilateral. The most common reason, as I mentioned, is because of the pressure of this nerve by a normal artery or vein at the point where it originates from the brainstem. The pain is very intense and it usually drives the patient to seek medical help. The first line of management for trigeminal neuralgia is always medical, where medicines are started. If medicines do not work, or if a patient is refractory to medical therapy even after 1 year, or if somebody is experiencing side effects of the medicines, then other kind of treatment options are considered. The invasive treatment options are of two types. One is the open surgical method and the other is the lesioning procedures. Lesioning procedures are otherwise known as ablative procedures because they work on destroying a small neural tissue, and they mainly work by reducing the current output from the trigeminal nerve. Some common side effects are usually these lesioning procedures. They may cause some numbness on one side of the face, and sometimes the effects caused by the treatment may not be permanent. One of the gold standard way of treating trigeminal neuralgia, if medical management fails, is via a cranial surgery which is known as microvascular decompression. Microvascular decompression is an open surgical procedure which involves making a small craniotomy or a small opening in the skull of the brain, usually behind the ear, through which we access or we gain an entry into the corridor where we see the trigeminal nerve. So via this procedure, we isolate the trigeminal nerve and we also see where exactly the pressure on the trigeminal nerve is seen arising. So if an artery or a vein is seen pressing on the nerve, then we gently separate the structure and we put a small piece of patch, usually of Teflon material, so as to isolate the artery from the nerve so that there is no longer any pressure on the origin of the trigeminal nerve. Microvascular decompression has got very good success rates. The only thing is that it's an invasive surgical procedure. Normally for anybody opting to go for this procedure, known as commonly as MVD, first of all, the patient should go through a pre-operative anesthesia checkup to assess the medical fitness of the patient for the procedure. Some of the routine investigations which are done prior to surgery include an MRI brain. The reason for doing the MRI brain is specifically to see whether we are able to isolate a neurovascular conflict, meaning whether we are actually able to see a vascular loop pressing upon the nerve as a reason for the severe trigeminal neuralgia. Sometimes there can be very rare causes such as multiple sclerosis or tumors, which can also produce a very similar kind of neuralgic pain. The other tests include the routine blood workup as a part of medical fitness for the surgery. So once a patient is medically considered to be fit to undergo this procedure, he or she is normally admitted a day prior to the surgery, and the next day the procedure is done, which is the craniotomy followed by the microvascular decompression. Post procedure, patients are usually extubated and made to come out of anesthesia, and they are observed in the neurosurgical unit overnight, and they are observed in the ward for about 2 to 3 days and then discharged and sent home. Post procedure, the medications for trigeminal neuralgia are normally continued for a few months because we cannot stop the medicine suddenly, and then over a period of time they are tapered and stopped. Microvascular decompression, if done for the right reasons, is a very gratifying procedure with very good results. Thank you.